My name is Dr. Silke Toy. I'm one of the histopathologists here at York Hospital, and I work with clinicians to look at the science of disease. That means I do not work with patients directly, but I'm given tissue samples at which I look under the microscope. For example, if you have a dark spot on your arm, you go to the GP, and the GP might take a sample of it, which then lands in our laboratory, gets processed, gets put on a slide. I will look at it, and then I can tell the GP, this is normal skin or this is abnormal skin. My work is really like being a detective, which I always really enjoyed about it, because you are presented with a form from the clinician with a clinical question. So when you read the question, you already think, what could it be maybe? Then you look down the microscope, look at the tissue structure presented to you, look at abnormal, normal areas, and you're just following clues really, like a real detective, and then you hopefully come to a good conclusion. The job of a pathologist can be quite varied. It's not only the tissue diagnosis, but we also undertake occasionally what we call postmortems, meaning we investigate the cause of death in people that deceased. And this is not like you see on television, it's not 6 Feet Under, it's not Quincy, it's all done in a very respectful clinical matter. It's purely there to investigate the cause of death. You need to be really inquisitive, you need to be very interested in the minutiae and little detail, because all what pathology boils down to is the science behind the cure. It's really helpful if you have an interest in science. If you're quite academic, if you're interested in research, there is a great scope for taking part in developing targeted therapies, clinical trials. For me, pathology was the only medical subject that combined it all. The science behind the disease, looking at the disease, and then talking to clinicians and integrating clinical medicine for the final diagnosis. In order to become a pathologist, you need a medical degree. And in order to obtain that, you have to obtain A-levels that should be centered around science. And after completion of your medical training at medical school, you will then complete 2 years of what we call foundation training, where you get a good broad base in all clinical subjects, and you will then undergo a 5 to 6 year training program, which is very studious. You have to be prepared to do a lot of studying, and it's really rewarding because you learn so many new things. You learn about histology, which is the tissue architecture and diagnosis. You learn about anatomy, which means organ structures and how they are related to each other. And you learn about cytopathology, which is centered around the individual cells in your body. And it's all coming together, and it's really, really satisfying to learn all of this. And many exams later, you will then become a qualified pathologist. I would recommend my specialty to anyone who's interested in more detailed, more scientific aspects of medicine, as it's not a real patient-facing specialty. And you have to be prepared to study a lot, but it is also very rewarding because you can put all your knowledge together with the clinical input to make a real difference to people.